Hi, everyone. My name is Dr. Samir Parekh. I am a hematologist at the Mayo Clinic in Rochester, Minnesota, and I am a member of the Medical Advisory Board of the CLL Society, and I'm joined here virtually for ASH 2021 by Dr. Chris Pleyer. He is at the NIH. Chris, would you like to introduce yourself?
Yes, of course. My name is Chris Pleyer. I am also a hematologist. I work at the National Institutes of Health in Bethesda. My research focus is in CLL with a focus on novel therapies and vaccines.
Thank you very much for taking the time today to chat with us. Could you please tell us about the study and why is it important to CLL patients?
With pleasure. So this was a study that was conceived a couple of years before COVID, actually, but turned out to be very timely in the way how interest in vaccine has surged, obviously, in the last 1 to 2 years. But we were interested in knowing more about how the immune system reacts to standard vaccinations in patients. And we had 2 concurrent studies, one using the hepatitis B vaccine, and then this study that was looking at the shingles vaccine. The reason why this vaccine is exciting is because it is a non-live recombinant vaccine that was recently approved and is therefore safe to give in patients with CLL, because whenever live vaccines are given, there is a concern that it could cause reactivation of shingles. But with this vaccine, that is not possible. So therefore, it is considered safe. And we were really interested in learning how CLL patients respond to this.
That's wonderful. So what were the main findings from the study?
Yeah, so we had 2 groups of patients, around 100 patients in total. And about half of these patients were treatment naive, so they hadn't received any therapy for their CLL before and were on watch and wait strategy. And the other half were patients receiving BTK inhibitors, specifically ibrutinib and acalabrutinib. We looked at both the responses from the antibody standpoint and also the T cells. What we found was that both the antibody and the T cell response is better in patients that are treatment naive compared to patients that are receiving a BTK inhibitor. And this is also being shown in more recent COVID studies as well, that BTK inhibitors do seem to impair the immune system response following vaccination. We also...
Sorry, go ahead.
One of the other findings that we saw is that the T cell response and the antibody response did not completely overlap. So in patients that had an antibody response, about 2/3 of patients also had a T cell response. When you look at patients who did not have a antibody response, about 1/3 of the patients still developed T cell responses. So the silver lining for patients is that even if there is no antibody response, there's still the chance that some patients do achieve a T cell response.
Yeah, no, I think that's wonderful to hear. So this is the Shingrix vaccine that we're talking about. And like you mentioned, this is a non-live vaccine. So what is the schedule of the vaccine that is approved and that was used for the study?
Yeah, so for this study, we gave the vaccine at baseline and then after 3 months. They chose that timing because it's also when we typically see patients in clinic again. But conceivably, the vaccine can be given up to 6 months after the first dose. So there is some flexibility in the FDA labeling, but we chose the 0 and 3 months. And then we actually chose the response assessment 3 months after that. So a total of 6 months after the first vaccination when we checked the response, which is slightly different how it's done in other comparable studies.
Yeah, no, and I think that's very important for our patients to remember is that this is a 2-part vaccine that needs to be administered, first dose now and the second dose anytime, in the next 6 months, between 2 and 6 months after they receive the first dose. Did your trial look at any side effects of the vaccination and were those significantly different than what you would expect?
Very good question. We had asked patients to fill out a adverse event diary. So all the symptoms that they had up to 7 days after the shot. And we saw that the side effects were overall very similar compared to what we see in healthy population. So patients in general have some pain, redness, swelling at the site, but those symptoms, if they are present, they are generally very self-limiting and they disappear within a couple of days.
So that's very reassuring.
Oh, sorry, what did you say?
No, I was going to say, I think that's very reassuring for patients to hear, because I think one of the major concerns a number of patients have with CLL is, will I react differently to a vaccine compared to somebody who does not have CLL? So I think this is reassuring to hear that you did not see any new or untoward side effects other than what was to be expected.
Yes, absolutely.
Good. Is the study still open? And if patients were willing to enroll, is there a mechanism for them to contact the study staff?
This specific study is unfortunately full to accrual. We are in a long-term follow-up, so we will be reporting long-term results in terms of what happens to antibody and cellular responses. We do have a new study that was recently approved by the Institutional Review Board and is going to open here at NIH in the next couple of weeks, where we are going to look at vaccine responses in CLL patients in a larger cohort. That will be open to patients that are not currently receiving any treatment, that are on BTK inhibitors, and are also receiving venetoclax therapy. One novel thing that we will be looking ahead at how we can improve immune responses for CLL patients is really the BTK cohort, which we'll be focusing on a lot, since they seem to be have the lowest vaccine responses. And we'll be offering patients the choice to hold the BTK inhibitor for 1 week before vaccination and 2 weeks afterwards. So for a total of 3 weeks at each dose. And we'll be testing the vaccine responses then. And we'll obviously be following patient CLL very closely during that time as well.
I think that's very important. And I think that's wonderful to hear, because I think there have been many studies that have actually looked at the decreased response to the vaccines, but I think trying to intervene and improve these responses is equally important and the obvious next step. So I'm sure that these studies will be available on your website as and when they become available. And if patients are interested, they could potentially sign up for these studies. Any final thoughts for the audience?
I want to thank all the patients and their families for participating in the study. Obviously, it's been a difficult few years for CLL patients as they've been disproportionately affected by COVID. But I definitely want to put a plug for the vaccine. If anyone has not gotten the vaccine, I definitely recommend all the standard vaccines and the COVID vaccine, as well as the booster as well. I think even though the antibody responses may not be perfect, there are more and more studies showing that there's likely other benefits to be derived from vaccination as well.
Absolutely. And I completely second all of that. So I thank you very much for your time today, for talking to us and educating our patients and caregivers and all of us alike. So thank you very much.
Thank you.